Thank you, and hello everyone. I acknowledge the traditional owners of the land on which I record this message, the Wurundjeri people. I pay my respects to their elders, past, present, and those who are emerging as leaders. It is an honour to officially launch this year's General Practice Health of the Nation report. The last 12 months have once again highlighted that communities rely on their GPs in times of crisis. Throughout the COVID-19 pandemic, our GPs, practice managers, nurses, receptionists, and administrative workers have persevered and done an absolutely incredible job. At the time of recording, practices have delivered over 16.7 million COVID-19 vaccines, more than half the national total, and probably by the time you're listening to this, much more. The General Practice Health of the Nation 2021 report underscores that GPs are more important now than ever and that we need greater support to help communities manage the fallout and the long tail of the pandemic. The vaccine rollout. Well, GPs are the backbone of the vaccine rollout. We are a ready-made mass vaccination centre. However, it has not been smooth sailing. Our survey found that almost 3 out of 5 GPs reported managing patient expectations about vaccinations to be one of the most challenging issues arising from the pandemic. Changes to vaccine eligibility requirements left many people confused, and unfortunately, some patients took out their frustrations on general practice staff. Similarly, the fact that different jurisdictions across Australia have different eligibility requirements and different rules applying in state-run vaccine hubs compared to practices and Commonwealth vaccination clinics has resulted in confusion and frustration for patients, and general practice bore the brunt of that frustration. Government can alleviate this additional pressure on practices by ensuring that practices are kept in the loop by government. General practice must be front of mind in all major public health decisions, including changes to the vaccine rollout. This was a national pandemic and needed a national response. The need for a one health system was never more stark. The vaccine rollout will have twists and turns ahead still to come, and GPs must be properly consulted so that we can best perform our very critical role. My message to all practices is that even through the difficulties, you are doing a remarkable job. You are the heralded heroes getting on with the job in the community, and I am extremely grateful for your work. Boosting the future GP workforce. We are in danger of running out of general practitioners. We can't just focus on the here and now of the vaccine rollout. We must also look ahead and be clear-eyed about the future of our profession. Not enough future doctors are opting for general practice. The GP workforce is ageing, with the proportion of GPs over the age of 65 increasing each year from 11.6% in 2015 to 13.3% in 2019. Almost 20% of GPs surveyed report they intend to retire within the next 5 years. This figure has increased from 14% in 2017. And at the same time, not enough medical graduates want to become GPs. The proportion of final year medical students listing general practice as their first preference specialty for future practice has fallen to just 15.2%. That's the lowest since 2012. So we know what the challenges are, and your RACGP is here to present solutions. I will advocate strongly and fearlessly for the progressive changes we need to serve our communities even better. Firstly, let me say, international medical graduates will continue to play a crucial role in bolstering the GP workforce. However, we must also focus on encouraging more future doctors in Australia to take up a career in general practice, especially in rural areas. Secondly, and just as important, is highlighting how rewarding this career path can be. However, it's also important to address what is holding back more future doctors from a career as a GP. And a great place to start would be putting general practice on a more sustainable, long-term financial footing, because funding for primary care as a proportion of total government healthcare spend is in decline. it is less than 8%, less than 8% of total health expenditure. Yet, we provide more than twice the number of episodes of care a year than hospitals at only 1/6 of the cost. As we revealed last year in the PricewaterhouseCoopers costed economic benefits of the vision for general practice and a sustainable health system, it's estimated that implementing the RACGP's vision and boosting primary care funding could provide benefits of $5.6 billion over the next 5 years. It's not the first time that evidence has pointed to primary care as the most cost-efficient part of the health system. More than half of GPs surveyed said that they would recommend general practice as a career to their junior colleagues, but a staggering 48% indicated they are much less likely to do so now compared to a decade ago. Those who would not recommend general practice as a career point to remuneration, recognition, and billing requirements. A recent News GP poll of more than 1,200 members also found 79% nominated increased remuneration for the profession as the best way to attract more medical graduates. Similarly, the most common challenge reported by GPs surveyed found that 71% thought fair remuneration for skills, with 58% suggesting managing fatigue and burnout. 50% of practice owners report they are concerned about the long-term viability of their practice. This is an increase from 37% in 2020. We know a lack of reward for work and declining autonomy are both risk factors for burnout. The picture is very, very clear, therefore. Remuneration, physician burnout, and viability of small business, we know what needs to be done. If the government is serious about boosting the general practice workforce of the future and ensuring all patients can access high-quality general practice care no matter where they live, then long-term funding arrangements must reflect this. The task of luring more future doctors into general practice will be made that much easier, and the savings for the entire health system would be immense. Attitudes at a fiscal, political, and electoral level must change. There is no point training world-class students into world-class doctors to offer merely a system-induced secondary career path. But there is some cause for optimism. Interest amongst medical graduates in entering the Australian General Practice Training Program, the largest single training pathway to a career in general practice, has been in decline, but yet this year's application round saw the highest number of applicants since 2017. Yay! Similarly, interest in joining the college's Practice Experience Pathway, or PEP, used by international medical graduates is growing, with the number of new enrolments increasing by more than 42% since 2019. Furthermore, GPs in training report high rates of satisfaction with their training position and workplace compared to their peers in non-GP specialist training. That should really bring a smile to our face. We know we are collegiate people when we know we can train and mentor the next generations well. To ensure a strong future GP workforce, we must also pay close attention to the mental health and well-being of GPs, not just the patients they care for. This is an essential part of the quadruple aim of health system reform. There has never been a more salient time to address this issue, with more than 50% of respondents to our survey reporting at least one negative impact to their well-being because of COVID-19, including 28% who nominated mental health. Government should address this by removing all mandatory notification laws so that GPs don't hesitate to reach out for help if they need it. The Western Australian model is working to respect both practitioner and the public's rights to safety in medical care. We need to reduce the stigma of talking about our very human needs for support and the way this supports the delivery of healthcare. And now, managing the fallout from the pandemic in the years ahead will be critical. Ask any GP, and the likelihood is they will report more and more patients presenting with mental health concerns. Individual mental health and well-being are intertwined with community and cultural health. This is a part of a longer-term trend. Our culture is showing its troubles. For the 5th year in a row, psychological conditions, including sleep disturbance and depression, were the most reported reasons for patient presentations. 80% of GPs report that they have patients with mental health conditions that are mostly managed within general practice. The scale of the parallel pandemic has only grown over the last 12 months. Unsurprisingly, the COVID-19 pandemic, including measures needed to contain the spread of the virus, such as lockdowns and economic effects leading to loss of employment, loss of choice, loss of joy in connecting, and often a loss of hope, these have impacted the mental health and well-being of many patients. Helplines such as Lifeline and Beyond Blue have reported increases in phone calls compared to previous years. The rate of mental health distress in the Australian community prior to the pandemic was sitting at 10%. In April in 2020, it was at 22%. But by November 2020, it was at 24%. This rate is more than double the rate of mental distress that we began the pandemic with. In my home state of Victoria, which has endured the most days under lockdown, the rate of Medicare-supported mental health services was higher than any other state or territory. There is no guarantee that mental health concerns will dissipate as communities increasingly open up. I suspect the effects of the pandemic will linger for some time, and GPs are perfectly positioned to help patients with mental health concerns. With greater support, we can do even more. Noting too that the figures concerning Medicare-supported mental health specific care are likely an underrepresentation of the true magnitude of GP mental health presentations, as longer mental health consultations in general practice are often billed as general consultation rather than a specific mental health item number. And I personally do this frequently. To help these patients, we need new Medicare item numbers for longer mental health consultations so that we can really get to the bottom of what's going on and spend the time that we need with our patients. Aged care and multimorbidities are another concern. The true measure of any society can be found in how it treats its most vulnerable members. The last 12 months has seen an increased focus on aged care. This could not have come soon enough. GPs play a vital and often an unrecognised role in caring for older people receiving aged care, including those in residential aged care facilities. People aged 65 and over represent 16% of the Australian population, but represent nearly 30% of all general practice consultations. Noting that 92% of all aged care occurs in the community outside of residential aged care facilities. Ensuring adequate access to general practice care can make an enormous difference. We know that people with dementia entering the aged care system are less likely to experience an increase in prescriptions for medications such as antipsychotics if they retain a relationship with their usual GP. When asked what would make GPs more likely to work in aged care, 67% of respondents said that better remuneration via Medicare items, more than 50% of GPs selected fewer administrative burdens, and more clinical staff in aged care setting as key drivers. Helping GPs get on with the job of helping older people in aged care is essential. Let us not have GPs sitting on their hands in aged care. And now on to complexity. It is also important to remember that GPs are the only medical practitioners that specialise in managing patients with multiple health conditions. We have a broad knowledge base and adopt a whole-of-person approach to care. Almost 75% of GPs surveyed report that more than 50% of their patients have multiple medical conditions. Australia has an ageing population, and that means that multimorbidity is increasing and more patients require complex care. The Medicare data shows that between 2010 and 2019, billing of long consultations lasting 20 to 40 minutes and prolonged consultations lasting more than 40 minutes have increased by 104% and 125% respectively. This is such an important contributor to workforce sustainability. There are therefore less hours available, less remuneration for complex care, and lowered morale as the system struggles with the demographic shifts. Almost 3/4 of surveyed GPs reported that more than half their patients have multiple medical conditions. This problem is particularly pronounced in the bush, with more GPs in rural and regional areas reporting that the majority of their patients have multi-morbidity. As things stand, Medicare discourages GPs from treating more than one condition, and especially in the same consultation. Even the medical software has an inbuilt informatics error of only recognising one condition for one consultation. Medicare billing also has this systemic error in managing general practice care. For example, many mental health items are unable to be claimed on the same day as a standard consultation or equivalent physical health item. This must change. Community general practice is a lifetime of interventions, not a single task-focused episodic model of healthcare. GPs provide comprehensive, holistic, patient-centred care, taking into consideration the life circumstances of each and every patient. To better help patients with multiple conditions who are at risk of ending up in hospital, we must change how we structure Medicare items. It is vital that we incentivise longer consultation items to support more comprehensive care by general practitioners. And so, in conclusion, the RACGP will continue fighting for general practices across Australia. Only when the vital role performed by general practice is properly recognised and properly supported, with resources given to our hardworking practices, can we truly say that we are committed to improving the health of the nation. We cannot have the nation's GPs sitting on their hands wanting to work to the fullest of their abilities and their training. That is wasting the talented people in the country that the country has trained to care for them. The people want it, the GPs want it, and it's time for the leaders of the country to work with us to deliver a vision of healthcare that is sustainable, that is evidence-based, and fiscally responsible. It needs to be delivered in the communities where people live, where they love, and where they work. To all practices and to the GPs of Australia, I say, keep up the great work. Your communities need you now more than ever before, and I salute your exceptional work at such an exceptional time when your community needed you. Thank you.